Well, for more on this, let's speak to Chris Skopec. He works for Project Hope, an international healthcare foundation, and he's joining us from Washington. Chris Skopec, good to have you with us here on the News Hour. So what lessons need to be learned from this pandemic for the next one?
Well, certainly preparedness is going to be critical. We've looked at the most recent example of a serious outbreak that we responded to as a global community. If you think of the 2014 Ebola outbreak in West Africa, the mechanisms for responding simply didn't work with coronavirus. We deployed massive resources that included chlorine, personal protective equipment, health experts from around the world to West Africa to help address that. Simply wasn't possible in the context of coronavirus and a true pandemic. People couldn't travel, global supply chains were restricted, countries nationalized their supply of PPE and other critical needed items, and countries were left to themselves.
I mean, it was a chance for the world to come together, wasn't it? I mean, what do you put that down to? Is that just human nature, the fact that it seemed that, as you say, countries just kind of went their own way and, in some respects, put up walls to stop helping other people?
Well, one of the things that we never took into consideration as we evaluated health systems around the world and their readiness to respond to outbreaks was the political dynamic and the ability for countries to, first and foremost, protect their own borders and protect their populations. But in the event of a pandemic, unfortunately, as we are realizing quite obviously, it's not possible to protect yourself without protecting your neighbors, without protecting the rest of the world. We've seen the inequity with vaccine distribution around the world. We can vaccine all we want in our countries, but if there are parts of the world that have the levels 3%, 2% in some countries of vaccination, it's inevitable that eventually variants will develop that are more dangerous and that vaccines are less effective against.
And Skopec, I'm glad you mentioned vaccine inequality, because it would seem that perhaps for the next pandemic, it does need to be in place that vaccines will be shared equitably. I mean, where do you stand on this idea of removing the patents, and what would need to be done for pharmaceutical companies to get on board with something like that?
Well, we've seen some encouraging examples of that with some of the major pharmaceutical companies ready and willing to share their intellectual property so that we can fast track the production of vaccines and treatment protocol and other things. It is essential, but we also have to look at we recognize a successful vaccine campaign doesn't just start and end with the production of vaccines. It is an entire system that needs to involve training of healthcare workers, supply chain and logistics that can support the distribution and the last mile distribution, and of course, very importantly, in some cases, most importantly, the health education and the information campaign to create trust with the communities and an understanding and knowledge. So a vaccine campaign really is an involved process that does require an extensive level of training and supporting health systems on the ground.
Okay, Chris Skopec from Project Hope, thank you for your time and best of luck in all of your work. Thank you.